Groin injuries, especially those involving the adductor tendons and rectus abdominis, are becoming increasingly common among athletes, particularly soccer players. These injuries often develop gradually due to chronic overloading rather than a single traumatic event. Patients typically experience pain in the groin or lower abdominal region, which worsens with activities like sprinting, pivoting, or shooting. Discomfort can radiate down the inner thigh and is often more pronounced after sports, with stiffness the following day. Understanding the underlying pathology is crucial, as both endogenous and exogenous factors influence the tendon's ability to handle stress. Early and accurate diagnosis helps prevent the progression of tissue damage and secondary inflammation, setting the stage for effective treatment. Diagnosing adductor tendinitis and rectus abdominis tendopathy involves a thorough clinical examination. Doctors look for local tenderness, pain during specific movements, and sometimes use imaging to rule out other conditions. Conservative treatment is always the first step, including rest, physiotherapy, anti-inflammatory medications, and stretching exercises. However, only about a third of patients with long-standing symptoms see significant improvement with these methods. For those who do not respond, surgical intervention may be considered. The surgical approach involves targeted procedures to release affected tendons and repair tissue, allowing most patients to return to sports within a few months. The choice between conservative and surgical treatment depends on the patient's motivation and willingness to modify activity levels. Long-term follow-up shows that surgical treatment for chronic adductor and abdominal tendon injuries yields high satisfaction rates, with most patients resuming sports activities within 10 to 14 weeks. Complications are rare and usually minor, such as temporary hematomas or superficial wound infections. However, the best results are seen in soccer players and runners, while athletes in sports like gymnastics or karate may experience different outcomes due to varying injury mechanisms. Despite the success of surgery, the ultimate goal should be better primary treatment and prevention. Early recognition, proper rehabilitation, and preventive measures like thorough warm-ups can reduce the risk of chronic injury and help athletes maintain peak performance.